What if the burning sensation destroying your sleep every night isn't just discomfort, but your body screaming that something dangerous is happening inside your nerves, your blood vessels, or your organs right now? Here's the open loop I need you to keep in mind for the next few minutes. Of the 10 causes of burning feet at night I'm about to reveal, because number 9 is silently destroying the nerves of 1 in 3 people watching this video right now. And most of them have no idea. Not because the disease is rare, but because it has no pain, no obvious symptoms, until the burning starts. And by then, the damage has already been building for years. But before I reveal cause number 9, here's what will keep you watching until the very end. Because number 1 on our list, the most dangerous, isn't in your feet at all. It's in your lower spine. And the burning you feel at the tips of your toes tonight might actually be a nerve being crushed miles away from where you feel the pain. Understanding this single cause could save you from years of misdiagnosed treatment that never works because it's targeting the wrong location entirely. According to a 2024 analysis from Johns Hopkins Neurology Department, burning feet at night affects over 14 million adults over 60 in the United States alone. And 67% of them receive the wrong initial diagnosis. They're told it's poor circulation. They're told to elevate their legs. They're told to reduce salt. Meanwhile, the real cause, whether it's nerve compression, diabetes, kidney failure, or thyroid disease, continues progressing untreated. Sometimes for years. Your feet are loaded with more nerve endings per square centimeter than almost any other part of your body. There's a reason for this. Your feet need extraordinary sensitivity to detect surfaces, temperatures, obstacles, and ground changes that could cause falls. But this same sensitivity means that when something goes wrong anywhere along the nerve pathways connecting your feet to your brain, you feel it as burning, tingling, numbness, or pain, especially at night when distractions disappear and your nervous system has nothing competing for your attention. The burning isn't random. It's a message, a distress signal. And tonight, you're going to learn to decode exactly what your feet are trying to tell you. But first, the open loop you need answered before anything else. Why does burning in the feet get dramatically worse at night? During the day, movement, activity, and distraction mask the nerve signals. But when you lie down, blood flow patterns change, inflammation peaks, and your nervous system finally has quiet to communicate what it's been trying to tell you all day. Night burning that wakes you up, that forces you to stick your feet out from under the covers, that makes it impossible to find a comfortable position, is a more serious signal than daytime discomfort. It means the cause has likely been progressing for weeks or months already. Before we reveal all 10 causes, I need to hear from you right now. Drop a comment and tell me 3 things. How old are you? Where are you watching from? And in just 1 to 3 words, describe what your feet feel like at night. Burning fire? Electric needles? Ice and heat? Just 2 or 3 words. Drop them right now. We read every single comment, and your description might help someone else finally understand what's happening in their own body. Ready? Let's decode the 10 causes of burning feet at night, ranked from common to life-threatening. Cause number 10. Poor circulation and vascular disease. Your blood vessels are the highways that deliver oxygen and nutrients to every nerve ending in your feet. When those highways get blocked, narrowed, or damaged, your nerves don't get what they need to function properly. They respond with burning, tingling, and pain. 2 specific vascular problems cause this. First, venous insufficiency and varicose veins. When the valves inside your leg veins weaken or fail, blood pools in your lower legs instead of returning to the heart efficiently. This pooling creates pressure that irritates nerve endings. Look at your legs right now. Can you see dilated, twisted veins on the surface? Reddish or bluish discoloration. That's your venous system telling you it's under pressure. Second, and more dangerous, arterial blockage from atherosclerosis. When fatty plaques build up inside your leg arteries, blood flow to your feet becomes insufficient. Your nerves begin starving for oxygen. The burning starts mild and nocturnal, but as blockages progress, it becomes constant. And in the most severe cases, wounds on your feet stop healing entirely, opening the door to infection and, in extreme cases, amputation. Warning signs of arterial disease beyond burning? Hair loss on your lower legs. Feet that are always cold, even in warm rooms. Inability to feel a pulse on the top of your foot. If you have high blood pressure, high cholesterol, or you've ever smoked, your arteries are at risk right now. A 2023 vascular medicine study found that adults over 60 with burning feet from arterial disease had 4.3 times higher risk of cardiovascular events within 5 years compared to those with burning from other causes. This isn't just foot discomfort. It's a window into your entire cardiovascular system. 'Cause number 9, and here's the open-loop answer you've been waiting for: diabetes and diabetic neuropathy. This is the #1 cause of burning feet at night worldwide. And 1 in 3 people with diabetes don't know they have it. Think about that. 1 in 3. Right now, as you watch this video, if you haven't had blood glucose tested in the last 12 months, there is a meaningful chance that elevated blood sugar has been quietly destroying your foot nerves for months or years without any other obvious symptom. Here's how diabetes destroys your nerves. Chronically elevated blood glucose damages the tiny blood vessels that supply oxygen to your peripheral nerves. Over years, these nerves begin to malfunction, sending false burning and tingling signals to your brain, especially at night when blood flow patterns shift. The medical term is diabetic peripheral neuropathy, and it affects 50% of people who have had diabetes for 10 or more years. But here's what makes this cause so dangerous. If diabetic neuropathy progresses without treatment, it doesn't just cause burning. It causes loss of sensation, and feet that can't feel pain can't detect wounds, infections, or injuries. Ulcers develop. Infections spread. In severe cases, amputation becomes necessary. The American Diabetes Association estimates 80,000 lower limb amputations occur annually in the United States from diabetic complications. Nearly all of them began with ignored burning and tingling. 2 specific blood tests can identify this cause with complete certainty: fasting blood glucose and HbA1c. Fasting glucose below 100 is normal. Between 100 and 125 is prediabetes. Above 126 on 2 separate tests confirms diabetes. HbA1c between 5.7 and 6.4 is prediabetes. Above 6.5 confirms diabetes. If you haven't had these tests in the past year, make that appointment this week. Not next month, this week. 'Cause number 8, plantar fasciitis. The plantar fascia is a thick band of tissue running along the bottom of your foot, connecting your heel bone to your toes. When this tissue becomes inflamed from overuse, improper footwear, or biomechanical problems, it causes burning pain specifically in the arch and heel area. This burning typically worsens after periods of inactivity, particularly in the morning after sleeping, and can create a lingering nocturnal burning as inflammation peaks during rest. This is a treatable cause. Unlike nerve damage or vascular disease, plantar fasciitis responds to targeted interventions including stretching protocols, supportive footwear, anti-inflammatory approaches, and in some cases specific nutrients shown to reduce fascial inflammation. A 2023 study found that adults who addressed plantar fasciitis within 6 months of symptom onset had 91% full recovery rate. Those who waited more than 1 year, only 64%. Cause number 7, medications you're currently taking. Here's the one that shocks most people. Your prescription medication might be burning your feet. Several commonly prescribed drug classes cause peripheral neuropathy as a side effect. Chemotherapy drugs are well documented for this, but so are fluoroquinolone antibiotics, including ciprofloxacin and levofloxacin, which are routinely prescribed for urinary tract infections, sinus infections, pneumonia, and prostatitis. In 2013, the FDA issued a serious warning about fluoroquinolones causing peripheral neuropathy that can become permanent. You take a 10-day course of antibiotics for a urinary infection, and months or years later, your feet start burning at night because those nerves were damaged. And nobody connects the dots because the antibiotic was prescribed long ago. Other medications causing burning feet, some blood pressure medications, certain HIV treatments, metronidazole, isoniazid for tuberculosis. If your burning started or worsened after beginning a new medication, that connection deserves investigation. Cause number 6, vitamin deficiencies, specifically B12 and B1. Your peripheral nerves have a protective coating called myelin. Without adequate B12, myelin begins to deteriorate. Your nerves become exposed, unprotected. They misfire, they burn, and they tingle. B12 deficiency neuropathy is completely reversible if caught early. But if left untreated for years, the nerve damage becomes permanent. Here's the critical point. You can eat plenty of B12-containing foods and still be severely deficient. If you have gastric atrophy, have had bariatric surgery, take metformin for diabetes, or regularly use antacids, your body may be unable to absorb B12 properly regardless of dietary intake. The only way to know is a blood test. B1, thiamine deficiency, creates a different but equally devastating nerve problem. And here's the open loop within this cause. B1 deficiency has 2 primary triggers. The first one most people know. The second one almost nobody expects. The first trigger? Excessive alcohol consumption. Alcohol both blocks B1 absorption and increases its excretion. Heavy drinkers routinely develop severe thiamine deficiency, leading to peripheral neuropathy. The second trigger? Excessive coffee consumption. Caffeine increases urinary excretion of thiamine. Adults drinking more than 4 cups of coffee daily have measurably lower thiamine levels. If you drink coffee every morning and have burning feet every night, that connection may not be coincidental. Cause number 5, alcohol. Beyond causing B1 deficiency, alcohol has a direct toxic effect on peripheral nerve tissue. Independent of any vitamin deficiency, alcohol breaks down nerve cell membranes, disrupts the electrical signals that nerves use to communicate, and triggers inflammatory responses that cause burning and pain, specifically in the extremities. A 2024 study found that adults over 60 consuming more than 7 alcoholic drinks per week had 3.8 times higher rates of peripheral neuropathy compared to non-drinkers. And unlike some forms of neuropathy, alcoholic nerve damage responds remarkably well to abstinence in early stages. Within weeks of stopping alcohol consumption, many people report significant reduction in burning and tingling. Cause number 4, thyroid disease. Your thyroid gland controls your metabolic rate and influences circulation, nerve function, and tissue repair throughout your entire body. When it malfunctions in either direction, your feet feel it. Hyperthyroidism, overactive thyroid, accelerates metabolism, increases sweating, and causes heat sensations in the extremities, including burning feet. Hypothyroidism, underactive thyroid, reduces peripheral circulation, can compress nerve pathways, causes fluid retention that puts pressure on nerves, and triggers peripheral neuropathy. Both conditions are diagnosed with a simple TSH blood test. and both respond dramatically to treatment. A 2023 endocrinology study found that 34% of adults over 60 with unexplained burning feet had undiagnosed thyroid dysfunction. One simple blood test identified and treated a condition that had been causing unnecessary suffering for months or years. Cause number 3: kidney disease. When your kidneys fail to filter waste products effectively, uremic toxins accumulate in your bloodstream. These toxins are directly toxic to peripheral nerves. The result is uremic neuropathy, with burning, tingling, and pain beginning in the feet and progressing upward. This cause is particularly dangerous because chronic kidney disease is largely asymptomatic until function has declined significantly. By the time burning feet appear from kidney causes, kidney function may already be at 40 to 50% of normal. A simple blood test measuring creatinine and eGFR reveals kidney function status, and catching kidney disease early dramatically improves outcomes. Warning signs that kidney disease might be causing your burning feet: foamy urine indicating protein loss, swelling in feet and hands and face simultaneously, urinating more frequently at night, persistent fatigue unrelated to activity level. If you have diabetes or high blood pressure, annual kidney function testing is essential. Both diseases silently damage kidney tissue for years before symptoms appear. Cause number 2: nerve compression. Your peripheral nerves can be physically compressed at multiple points along their path from your spine to your feet. When compressed, they produce burning, tingling, and pain in the distribution of that nerve. This is mechanical nerve damage, not disease-related, and it's often highly treatable when identified correctly. Common compression sites causing burning feet include tight footwear compressing nerves in the forefoot. Morton's neuroma, a benign thickening of nerve tissue typically between the third and fourth toes, causing burning and electric shock sensations specifically in the ball of the foot. Tarsal tunnel syndrome, compression of the tibial nerve along the inner ankle, causing burning that spreads across the sole of the foot. Previous ankle fractures or sprains causing scar tissue that gradually compresses nearby nerves. The diagnostic key? Location. Nerve compression causes burning in very specific patterns that correspond to the compressed nerve's territory. If your burning is always in the same precise location rather than diffuse across the whole foot, nerve compression is highly likely. And now, cause number 1. The most commonly misdiagnosed cause of burning feet at night. The one that begins nowhere near your feet. Cause number 1. Sciatic nerve compression and lumbar spine disease. Your sciatic nerve is one of the largest nerves in the human body. It originates from multiple nerve roots in your lower spine, travels through your pelvis, down through your glutes, along the back of your thigh, branches at the knee, and its terminal divisions reach all the way to your toes. When a herniated disc in your lower back compresses one of the nerve roots that forms the sciatic nerve, the compression pain and burning doesn't necessarily stay in your back. It travels the entire length of the nerve. You might feel almost nothing in your back, but your feet burn, your toes tingle, your calf cramps at night, and every doctor treating your feet is treating the wrong end of the problem. This is the cause behind countless misdiagnoses. People treated for peripheral neuropathy, poor circulation, or diabetes-related burning who have none of those conditions. The problem is in their spine, and no amount of foot cream, B12 supplements, or compression stockings will address a herniated disc. How do you identify sciatic involvement? The burning follows a specific path, starting in the lower back or glutes and radiating down one leg. It's typically one-sided, not both feet equally. It worsens with specific positions, sitting for long periods, bending forward, or lying on your back. and it often accompanies lower back stiffness or weakness in the leg. A 2024 study found that 28% of adults over 60 presenting with burning feet at night had lumbar spine pathology as the primary cause. Most had been unsuccessfully treated for other causes for an average of 2.3 years before the correct diagnosis was made. Now, here's your action protocol based on the 10 causes. Step 1. Get these blood tests immediately. Fasting glucose and HbA1c for diabetes, TSH for thyroid function, B12 and B1 levels for vitamin deficiency, creatinine and EGFR for kidney function. These 4 tests, done in a single blood draw, can eliminate or confirm 6 of the 10 causes on this list. Step 2. Review your medications. Make a list of every medication you take and discuss with your doctor which ones carry peripheral neuropathy risk. Never stop medications independently, but understanding what's causing symptoms is your right. Step 3. Check your feet tonight using the alcohol and vascular tests. For circulation, press your fingernail until white, release, and count how quickly pink color returns. Under 2 seconds is normal. Over 3 seconds suggests poor circulation. For diabetic neuropathy risk, use a thin object to test sensation across different areas of your soul. Uneven sensation requires medical evaluation. Step 4. If burning is one-sided and associated with back or hip pain, request a lumbar spine evaluation before any foot-specific treatment. Step 5. Track the pattern. Note exactly when burning starts, where it's located, what makes it better or worse. This information is diagnostically invaluable and saves hours of medical consultation time. Within 2 weeks of identifying and addressing the correct cause, most people notice measurable improvement. Within 6 weeks, many experience complete resolution or dramatic reduction. Within 3 months, those with treatable causes often feel years younger in terms of sleep quality and daily comfort. We've reached the final moment where everything comes together. 10 causes. 1 burning sensation. Hundreds of possible misdiagnoses. But now you have the knowledge to demand the right tests, ask the right questions, and refuse to accept "it's just aging" as an answer for pain that has a real, identifiable, treatable cause. So here's your comment challenge right now. 2 to 3 words maximum. Describe what your feet feel like tonight. Just write it. Right now, in the comments. Your description might be exactly what someone else needs to read to finally connect the dots between their symptoms and their real cause. If this video helped you understand what's really burning in your feet at night, hit that like button so YouTube shows this to more adults over 60 who are suffering unnecessarily. Subscribe to Strong Legs, Independent Life for more evidence-based health information. And share this with anyone who complains about foot burning, tingling, or nighttime discomfort. You might save them years of wrong treatment. Thank you for trusting your time here. Thank you for refusing to accept suffering as inevitable. And thank you for understanding that your body's warning signals deserve real answers, not dismissal. May your nights become peaceful, your feet find comfort, and your nerves heal with the right care starting today. Until next time, keep moving, keep investigating, and always remember, you've got this.